Thank you so much, 𝘊𝘈𝘈𝘗𝘗. Our moderator for this today is Dr. Rashmira Balasuriya, the technical advisor of the CAP project. She will provide the brief introduction to this session and introduce our presenters also. I encourage all of you to engage actively in this session and ask questions, share your thoughts. Let's engage in meaningful dialogue.
Good afternoon, everybody. Thank you for joining us today for a very interesting panel discussion on menstrual health, hygiene, and period poverty in Sri Lanka. Period poverty is a significant issue not just in Sri Lanka but also globally. But of recent times in Sri Lanka, there has been immense discourse on the topic. Period poverty is a complex issue. It's not just about giving people pads. It's much more complex than that. It's about the lack of access and affordable menstrual hygiene products, the lack of access to water and sanitation facilities, the myths, stigma, and discrimination menstruators face, and also about taxation on menstrual hygiene products. With all these problems, you will understand that there has to be a multi-pronged approach when we come to addressing period poverty. And compounding all these challenges, the cultural taboos, stigmas, we need open discussions around menstruation to prevent marginalizing menstruators. Approximately 50% of menstruators in Sri Lanka currently face period poverty. This panel discussion is part of our ongoing efforts to tackle the multifaceted issue of period poverty through meaningful dialogue and evidence-based advocacy. This session will highlight key areas such as national level discussions on menstrual health and hygiene management, along with relevant statistics and studies on period poverty in Sri Lanka. We will also share findings from a recent study on menstrual practices and policies and focus on eliminating stigma and discrimination while improving access to menstrual products. The objective is to create a collaborative platform where stakeholders can exchange knowledge, offer insights, and identify actionable solutions to break down barriers for menstruators, ultimately fostering sustainable and inclusive approaches to menstrual health and hygiene. We have three esteemed panelists with us today, all who have worked quite significantly in the field of period poverty in Sri Lanka.